Have you ever felt sudden electric shock-like pain on your face, or pain when brushing your teeth, talking, or even touching your face? It might actually not be toothache. It might be a trigeminal nerve problem, one of the most painful nerve conditions in the body. Let's talk about problems of the trigeminal nerves, causes, symptoms, and treatment. But before that,
The trigeminal nerve, the largest cranial nerve in the head, built for sensation, control, and rapid response. It branches into three major divisions, spreading across the face, the scalp, and the jaw, carrying signals from skin, teeth, and deep structures. With every touch, temperature change, or pressure, sensory receptors activate, sending electrical signals through this nerve toward the brain. These signals travel to brainstem nuclei, where they are processed and interpreted as pain, texture, heat, or movement. This is how the face feels. But the trigeminal nerve does more than sense. Its motor branch controls the muscles of chewing, allowing the jaw to open, close, and generate force with precision. It also powers protective reflexes. A sudden stimulus, a sharp touch, a burst of heat or irritation in the eye can trigger an immediate response, like blinking or pulling away before conscious thought. Because of its reach, it is constantly active, monitoring, responding, and coordinating input from one of the body's most sensitive regions. When disrupted, signals can intensify, misfire, or become painful, even from light touch. Fast, expansive, and deeply connected, the trigeminal nerve is more than a pathway. It is the face's sensory network, a motor controller, and a rapid response system linking the external world directly to the brain.
now you've heard about the meaning of trigeminal nerves. You've learned a lot about it. Now let's look at the problems and complications of the trigeminal nerves. Number one, we're going to look at trigeminal nerve neuralgia. You're hearing this for the first time here, right? But this is the most common trigeminal nerve problems common among patients, common among people that come to the hospital. Now, what are the symptoms? The symptoms are sudden severe facial pain, electric shock like pain when chewing, like when trying to chew something that is hard or something that is solid, pain when brushing your teeth, like in the morning or anytime you're trying to brush your teeth, and also pain when touching your face, like a little touch on your face that is supposed not to be like something serious or too bad, but you feel so much pain. You feel something like shock, like electric shock, like electric running through your face, so running through your skin. Another one is one-sided facial pain. Sometimes you may be feeling pain just on one side or on the other side of the cheek, or sometimes when wake up in the morning you feel like something developed on the other side of your cheek. Most times if, the patient feels one-sided facial pain. Now, the pain can last like seconds to a minute, but may happen many times daily. These are not conditions that undergo or last for a long time or have a long span of pain, but just something that happens suddenly or within a few seconds to few minutes. This condition is also called suicide disease because of how painful it is. And number two in our list, number two complications, or we call it problems, is trigeminal neuropathy. Trigeminal neuropathy. This happens when the nerves becomes damaged. Now, what are the symptoms? The symptoms include facial numbness, reduced sensation, weak chewing muscles, like you cannot chew something that is hard, and then tingling sensation, feeling like something is tingling or something is moving inside your muscles or your face. And then number three in the complications and the problems is herpes zoster affecting trigeminal nerves. Now, when shingles affects the trigeminal nerves, what are the symptoms? What does the patient experience? The patient experiences severe facial pain, like we said earlier, and also blisters on the face, and also eye pain, and also burning sensation, like I've mentioned earlier. And this can lead to post-herpetic neuralgia, that is long-term pain. And number four in our list includes multiple sclerosis affecting trigeminal nerves. Now, in some patients, multiple sclerosis damage trigeminal nerves. what are the symptoms? The symptoms include facial pain, like I've mentioned earlier, facial numbness, like you cannot feel anything when you touch your face, weakness in chewing muscles, like I've just mentioned earlier. Now, what are the causes of trigeminal nerves problem? Let's look at the root causes. Like what causes trigeminal nerves problem? Now, number one in our list include nerves compression by blood vessels, and then tumors, trauma to face, multiple sclerosis, diabetes, viral infections, dental procedures, like when someone have a dental problem or dental complications, or when undergoing a dental procedures in the hospitals. And then what are the risk factors? That what ages or who is this mostly associated with? The risk factors involve age above 40 years, like comes with hypertension, like what actually leads to trigeminal nerves complications. Sometimes patients or people above 40 years, and then hypertension problems, someone who is already having hypertension or high blood pressure problems complications, and then a patient who is already with the diabetes complication, a female gender, and then multiple sclerosis patients. And then when such patients get to the hospitals, or when someone who is undergoing such complications goes to the hospitals, what would they do in the hospitals? So when you get to diagnostic centers, normally the doctors may do clinical examination, and then they'll carry out MRI scan, and they carry out CT scan, and also neurological examination. Now, these are some of the medications or the treatments that you may be given. And I will advise that you do not go to the hospitals or the pharmacy to get some of these drugs by yourself. It should be strictly based on prescription or doctor's advice. Now, some of the common medications include carbamazepine, that is the first line of drugs, and then gabapentin, and then the third one is pregabalin, and then the fourth one is baclofen, and then the fifth one is amitriptyline. And then these drugs helps reduce nerves pain. Now, someone who is undergoing a trigeminal nerves problem may sometimes experience some of these things that I will mention, which include depression. Such patients or person may also experience weight loss, poor nutrition. The person may not be feeding well, and also anxiety, worries and anxiety, and also reduced quality of life. The person might be restricting he or herself from going out or from involving in social activities. And then trigeminal nerves problems are very painful, but they are treatable, and this is very important. But early diagnosis, early checkup, early discovery and treatment will prevent complications. Now, if you feel sudden pain, don't ignore it. Please see a doctor immediately. If you have learned something new in this video, and this video have impacted you a lot, don't forget to like, share and subscribe, and please share it to other persons, to your friends and family, so that they can learn and know about their health status. Thank you very much, and see you in my next video.